behalf of the board, into the board to talk about community threat assessments for 2025, what that looks like, and really want to start with the overdose statistics. So we've been paying attention to those overdose deaths for several years, trying to understand the trends. I think it was very valuable for us to have that, and I'll show you what this looks like in a moment. But we finally have, if you want to use the word good news, I would say better news than we've had in 6 years, and that is a decrease in overdose deaths in Butte County for the first time in 6 years. So that's pretty significant. We have not seen that, like I said, for a while, and so any decrease right now, I think, is a positive step in the right direction. So let's look at those numbers. As you see, back in 2019, we had 56 deaths attributed to overdose, 75 in 2020, 114 in 21, 123 in 22, 134 in 23. That was the high water mark back in 23. And then last year, in 2024, 115. So almost at the same level of 2021. So again, I don't think you want to jump up and down when 115 people die from overdose, but you do want to acknowledge the decrease, and that's what we're seeing. And that represents a 14% decrease in overdose deaths. And there is one case that's still pending toxicology results, so that could go down to 13.5 if you want to split hairs. So let's look at what actually is killing Butte County residents. And again, we provided these statistics in Butte County because it provides a more detailed look at these numbers. There are a lot of numbers from the state, a lot of numbers nationally, but we need to know what's going on in Butte County. That's why we started to dig into these overdose deaths. So just for context, back in 2018, we had 0 fentanyl-related deaths. 0. We had 3 in 2019. I'll talk about an incident that occurred back then in a moment. 2020 saw 9, 41 in 21, 65 in 22, 77 in 23, and then 54 in 2024. And if I go back a second to the overdose deaths, the overall death rates, when you compare 23 and go back to 2018, that was a 173% increase. 173. But this decrease as it relates to fentanyl is also significant. It's a nearly 30% decrease in fentanyl-related deaths last year. That's pretty positive. So meth has killed more people, and that's the misnomer, the misunderstanding, sometimes as it relates to overdose data, particularly in Butte County. Butte County has had a long-standing issue with meth that goes back several decades. It has never left us and is still here, and it kills more people today than does fentanyl. I think that's important to remember. And I think there's some additional purpose or reasons why that is. But meth killed 88 people last year. Again, a high water mark in 23 was 94, 88, 79, 54, and 37 back in 2019. So you saw really those numbers, the fentanyl numbers, were really skyrocketing. And the other interesting note that I wanted to bring to your attention is all other opioid deaths. So back in 2019, and when I say all other opioids, that's everything other than fentanyl. That's heroin, prescription opioids, it's all of that combined into one category. So in 2019, far outdistanced fentanyl deaths. 2020, you saw that gap starting to shorten. In 2021, fentanyl overtook all other opioid-related deaths. In 22, nearly doubled those deaths. And in 23, more than doubled those deaths, and then in 24 when that number went down, a little close to where it was again back between 21 and 22. That is a huge, huge increase. And for the first time, like I said, a decrease in fentanyl-related deaths. The opioid crisis, as I've said many times, is now a synthetic one. You know, we've talked about the prescription opioid crisis. This is now a synthetic drug crisis. I don't include methamphetamine in that. And if you want to understand the why behind that, it all gets down to dollars and cents. And if you look at this as a business model, if you have to grow something like poppies for heroin, you know, coca plants for cocaine, there's growing seasons, there are limitations. Typically have to do that outside. With synthetics, you can run a lab 24/7, 365, and it's easy to conceal. You can see why that happens. So, again, we all understand how potent fentanyl is. You know, that's a fatal dose of fentanyl, as is that. It's grains of sand, grains of salt. It does not take much to kill. So I want to talk about one case that we had in Chico. Last year was at a Chico motel. A Chico police officer developed information that someone was dealing fentanyl, one of our local downtown motels. Benta became involved with that officer and worked a case and seized this fentanyl. The disturbing part of this, there's a 3 and 5-year-old in that motel room. So that is the desk, the area between the two beds, about eye level with the 3 and 5-year-old. And if you see right in the middle, upper middle of that particular shot, you see a green dinosaur, green alligator. That is a bong, a fentanyl bong for smoking. That looks like a kid's toy. So all the fentanyl there in the desk was accessible by the kids, as was that bong. Again, another fentanyl bong that was in the bathroom. Again, easy access to the kids. And unfortunately, both the 3 and 5-year-old tested positive. Somehow, by the grace of God, they did not die. Got those kids out of the situation that they were in and got them into a safe location. But that's one incident involving fentanyl dealers, and a 3 and 5-year-old. So when we talk about this crisis, we talk about the people that die and everything else, but really it's driven by money, driven by commerce. You have to think of it as a business, and to protect your business, you must use violence, you must use firearms. This was a case recently this year. Stopped a guy with a large quantity of fentanyl. You see that on the black sheet, which is a little bigger than that grease board right there, just to give you some context how much fentanyl that was. But in Chico, he was producing guns. Assault rifles, handguns. He literally had an assembly line made up in his residence. And he was selling these firearms to known criminals that we believe were actually getting in the hands of drug trafficking organizations. That's still yet to be determined. Again, one case. That's a lot of guns. And if you can see the machines that are up in the upper middle portion, excuse me, of that shot, those are 3D printers, and he was able to make gun parts from those printing machines to include what are commonly called Glock switches to turn handguns into fully automatic weapons. Just a little aside on that case. So I did want to discuss what we are doing in Butte County to address this crisis, what we have been doing for several years and what we've been doing recently. So back in 2022, Butte County applied for a high-intensity drug trafficking area designation, which comes out of the Office of the President back in Washington, D.C., through ONDCP. And I know people were confused that maybe this was a negative, that they were designated Butte County as a high trafficking area. It was none of that. This was actually something we sought because what HIDA brings to us, and by the way, we were awarded that in 2022, only one of 5 counties in the entire nation, the only one west of the Mississippi in that year. And what HIDA does is they bring resources and connections, collaboration, both on the enforcement side, but also on the prevention side. So they have 2 prongs to their approach, which I believe is the appropriate way to attack this particular problem. And it's brought not only dollars into Butte County to help us fight this crisis, but also resources, again, collaboration. We have connections with task forces throughout the country that are associated with HIDA, and it's been a very, very significant relationship, a very good one for Butte County, and will be moving forward as well. So as I said, this is not just an enforcement issue. This is an issue for the entire community, and I just threw up a couple of organizations that are dealing with this particular crisis, along with BENTIF, with all our law enforcement agencies in Butte County, and they attack it from a number of different aspects, just as we attack the enforcement side. So I want to talk about naloxone. So back in 2018, a young commander, whose last name begins with A, came to me. I was chief of police, and said, "Chief, I want our officers to start carrying naloxone. I think it would be a good idea. A lot of threats related to fentanyl overdoses." And so in my mind at the time, my perspective of naloxone was it was a syringe. And I wasn't too keen on the idea of officers jabbing people with syringes to administer the dose of naloxone. Well, no, he said, no, that's not the case. It's actually a spray that goes into the nasal cavity, and even if you were wrong on your diagnosis, it's not going to do any harm. So, in partnership with Public Health, Butte County Public Health, we went ahead, and outfitted, outfitted our police officers with naloxone, which is a little controversial at the time. And in early 2019, January of 2019, we had a mass overdose event. 12 people hospitalized, one dead, and no doubt that naloxone that was administered by our police officers, the firefighters had come on board as well, and EMS no doubt saved 5 to 6 lives that particular morning. And so I thank that unnamed commander, whose last name begins with A, for bringing that and public health as well to my attention. Drug-endangered children, I talked about the true victims in this crisis are the kids that are exposed to this. And not just exposed to the drug itself, but also everything that goes along with it, the violence, degradation, everything else. They're really horrific conditions. If you've ever been inside one of those houses, it's pretty shocking. And it's a place that kids should not have to experience. So this was actually started in Butte County out of District Attorney Ramsey's office several decades ago, and really designed to focus on children in those situations. And we have practiced DEC for several decades in BENTIF, and really something that has become not only national, but international in scope, and that all started in Butte County. Talk a little bit about drug court and Prop 36. So drug court, really is a second chance for people that are suffering from addiction. It's really a fantastic program, and there have been many, many success stories. I have attended, I know others, to include Mr. Ramsey, have attended, And the stories are really inspiring. People that are suffering from addiction, that go through a program, court mandated, and come out on the other side much happier, much healthier people. A very, very important part of this effort. And then Prop 36 really gave us some tools to address those that profit from this crisis, that are selling the fentanyl and what have you, and actually making profit off people dying. That has put some teeth where it needs to be put, and given our district attorney a few more tools to deal with when we have those situations. I think it's been a valuable tool for us. In conjunction with Action News Now and Butte Office of Education and others, many from that slide that you saw in the community, we created a fentanyl awareness video, and really the design of that was we would take students from local high schools in Butte County, and they would do a newscast on the dangers of fentanyl. So if you think about how these drug trafficking organizations increase their profits, they increase their profits by selling higher, but also increasing their base, right? Those that they're selling to. And if you looked at their marketing tactics, if you want to use that term, they would take the fentanyl and package it in a way that looked very innocuous, right? It was a little M30 pill, a little blue pill. Doesn't look dangerous at all. A pastel-colored powder. Again, it was all designed to make it look safe and make it more appealing. So we had concerns that our kids were going to be exposed accidentally to this, and we wanted them to have some information that would protect them in future if they came across potential fentanyl-laced items. So students went out and interviewed many esteemed members of our community, like our district attorney, and really did a news story on fentanyl. And that was broadcast on our local affiliates, CBS 12 and NBC 24 back in May of last year. A completely student-run operation. They just used the facilities at Action News Now and produced that not only for the public, but also for schools, for showing in our schools in Butte County. And I think that was an outstanding way to get education, information in the hands of our kids in a creative way. And last but not least, BNTF. We play a role and have played a role. This is a dangerous business, and I never want to make light of that. You know, we say those terms, we use that language. You know, this is dangerous, this is whatever. But that really was highlighted, I think, shown to us in a really tangible way when Officer Osmar Rodarte lost his life serving search warrants related to a transnational drug organization. We take that personally here as well because we were serving warrants in Butte County and in Tehama County in support of that investigation. It was really the culmination of many years dealing with this transnational organization. It was really the ending of that investigation by the serving of multiple search warrants, again, in the Yuba Sutter area and in Butte County and in Tehama County. We participated in that because that particular investigation spread its tentacles into Butte County and Tehama County, so we were involved. And Officer Rodarte lost his life serving his in our community. And I want to make note of that as well. So with that, I'm going to turn it over to any questions you guys may have. I have the district attorney here as well. Thank you, Mr. Ramsey, for coming, and see if you have anything for us.
Are these, for what do you say, there's 123 people who died in 2022. Is that from January to December?
I use the calendar year, yes. So if you look at the CDC data, it's a little different. That's usually a different time frame, so it can be a little confusing, but we use the calendar year.
What do you attribute to the decrease this year? Or do you have any attributions?
So I think it's everything that I just mentioned. So, you know, the collaboration, the efforts of a number of people, and like I said, the prescription opioid crisis what did you have? You had pharmaceuticals producing these substances, right? And physicians who were prescribing it. And so if you had bad actors in any of those two categories, you really had